Hello everyone.
Hello, ma'am.
Can you hear me, all of you? Am I audible?
Ma'am, good evening, ma'am.
Good
Yeah.
evening,
Good
ma'am.
evening, ma'am.
Is my voice clear?
You are audible, ma'am.
Yes. Okay. So today we will be talking about mood disorders. Okay. So as the name itself suggests, uh, mood disorder is it's the disorders which are related to a person's moods or emotions. Okay. So mood disorders, they affect people emotionally. So there are two things which are very, what you can say, typical of mood disorder is two key emotions when we are talking about mood disorders. So one thing which I want to bring to your notice is previously in DSM-4-TR, there was a category called mood disorders under which we had unipolar depression and bipolar disorders. Now, what they have done is they've taken out depression and given it its own chapter, and they have taken out bipolar disorders and given it its own chapter. Okay, but
Excuse
both
me,
of
ma'am.
yes,
What was that text you said just now, ma'am? What TR is it?
huh?
You were explaining something, right? In which book is it, ma'am? You said some SOC TCR?
I'm talking about DSM-4-TR.
Okay, ma'am. Thank you, ma'am.
Okay, so DSM-4-TR had uh, a chapter. I mean, in the classificatory system, they had mood disorders as one category under which depression and excuse me and bipolar were covered. And in the current DSM-5 classification or edition of DSM-5 uh, edition, I mean DSM fifth edition, they have given depression as its own chapter and bipolar as their own chapter. Okay, so as I told you, depression, I'm sorry, by mood disorders, when we talk about two mood disorders, we're talking that, mood disorders here, people are affected emotionally. Okay, and there are two core, but see, for your information, I said they have split the mood disorders and given their own chapters. But today in our lesson, I'll be talking about under the umbrella of mood disorders, I'm going to talk about depression and bipolar disorders, both of them. Okay, because that is how they are covered in your lesson. Okay, so there are two key elements when you talk about mood disorders. Those two key elements are depression and mania. Depression is, characterized by low, sad state in which life seems dark and challenges of life, they feel very overwhelming. The person is continuously has very low mood, feels sad all the time, helpless, hopeless. Okay, and now the complete opposite to that is mania. So, in a manic state, the person would experience, heightened levels of what you can say, energy, euphoria. They will feel like, excessive levels of self-confidence, grandiosity, self-esteem, and frenzied level of energy. So, completely opposite to depression. Okay. So, now, when we talk about mood disorders, so as I told you, two categories. I mean, bipolar and unipolar. So when we talk about unipolar, we are talking about depression. Okay, so there are mood disorders are divided into two major groups: depressive disorders and bipolar disorders. And each group include several different types of disorder under each group. Okay, so when you are talking about depression, the person will be depressive disorders. The person is feels constantly sad. Okay, sometimes they experience anxiety also. And bipolar disorder, the person would likely have extreme mood swings. They feel like, as I just mentioned, grandiose idea, euphoric, very happy, very energetic. And sometimes their mood will swing back and forth also. In certain types, there are different types under bipolar. So in certain types, in one day itself, they will swing from depression to mania. Okay, so they go back and forth when it comes to mood. So, and it has been found that having a mood disorder increases risk for suicide also in a person. Okay, so now, as I mentioned, each group includes depression. There are two groups under mood disorders: depressive disorders and bipolar disorders. And each group includes several different types. So depressive disorders are the overview or the main feature of depressive disorders includes the person will experience loss of pressure in everyday activities. Okay, and it will ultimately affect their quality of life, their functioning. They will experience lack of energy, will have trouble sleeping, trouble concentrating. Changes in appetite will also be seen, and there will be lack of interest in any pleasurable activities. They will not enjoy any social activities, any activities, pleasurable activities which previously used to make them happy. And they will also experience feelings of helplessness, hopelessness, and self-esteem will be very low in with persons suffering from depressive disorders. They'll have feelings of worthlessness and guilt also, and and they will experience excessive levels of fatigue, feel continuously tired. And there are different types of depressive disorders. Uh, I'll fastly name them, then I will take you in detail, explain them to you. The important ones out of this list, the most important ones are covered in detail in your lesson, and you need to learn only those only. So the different disorders under depressive disorders, thus major depression. First one is major depression, which the main important criteria is the just now which the list of signs which I mentioned. The person should experience those symptoms for at least 2 weeks, and often they should be longer than 4 weeks. Okay, minimum 2 weeks. Seasonal affective disorder is uh, it has been found like certain times in a year, like certain seasons, especially winter season. They found that lack of sunlight makes a person feel depressed. So there is something called seasonal affective disorder, which has been observed in countries where they experience very poor sunlight, and it has been found that people, who during winter seasons or where they experience very less sunlight, they have depression. I mean, they experience symptoms of depression. And persistent depressive disorder is here, it is a long-term form of, see, major depression, I said minimum 2 weeks. And sometimes, see, difference between persistent depressive disorder and major depression is major depression, there can be an episode of major depression after treatment, the person becomes all right. Okay. But under persistent depressive disorder, it is a long term, like continuously the person feels depressed. It will not be as severe as major depression, but the person is, for years together continuously would long-term form of depression where milder levels of symptoms such as sadness, emptiness, hopelessness are experienced for a longer duration, often going to years. Disruptive mood regulation disorder, dysregulation disorder is another type of disorder under a depressive disorder. And here, this is this diagnosis is used for children and teenagers. And the symptoms, it features constant, serious, and lasting, see, difference between adult and children. So if children or adolescents have depression, and in an adult, the symptoms will be sadness. But here in children and adolescents, depression expresses itself in the form of irritableness, testiness, and anger. That is what the feature. Those features are observed in children and adolescents. So it features constant, serious, and lasting testiness. That is crankiness, irritableness, frequent temper outburst. Okay, that are not consistent with the age of the child. That is very, very important. Especially, you have to be very careful. Uh, just because you know about psychological disorders, yeah, when you're talking about children and adolescent, developmental stage is very important. You should not be over enthusiastic in diagnosing. So certain behavioral problems or certain behaviors uh, mm, uh, which are appropriate to that age, you cannot call them as having the child is having behavior problem. So behaviors which are not appropriate to the age, for example, like in a 1 year old child, 1.5 year old child, he or she will pull hair and all that. Okay, so that is age appropriate. You cannot call that this child has behavior problems. Okay, but a 5 year old child, 6 year old child pulling hair, that is problematic. Okay, so so these temper outbursts, okay, are not consistent with the age of the child. The next disorder is premenstrual dysphoric disorder. It features mood changes, hopelessness, and feelings of being overwhelmed or out of control. And these symptoms occur in the 10 days before a menstrual period and go away within a few days after a period begins. The next disorder is depression related to a medical condition. It features a great loss of pleasure in most or all activities due to effects of some medical health problem. Okay, the person is experiencing symptoms of depression because of effects of some medical health problem. And the last is depression related to substance or medical use.
Mom, sixth one, please.
Huh?
Sixth one.
Depression related to a medical condition, some physical health issue. And
Okay.
because of that health issue, for example, one of the examples I can give you is hypothyroid. Okay, so if a person has hypothyroid, here the condition here uh, the person is suffering from a physical health condition, but that physical health condition will present itself in the symptoms would be psychological in nature. So that is why whenever we have patients coming with you know what you can say symptoms of depression, we also ask them to go and take thyroid tests, because sometimes thyroid problems with the thyroid levels can present as depression or anxiety. If it is hyperthyroid, the symptoms would be anxiety, high levels of anxiety. Understand? So you have to rule that out. Understood?
Yes, ma'am.
Yeah. So, and the last is depression related to substance or medical use, medicine use. Sorry. So, features of depression, depressive symptoms that start during or soon after using some drug, some street drug, or some medicine, or suddenly the person has stopped using that medicine, and there are withdrawal symptoms because of these. Because see, when you are taking some drug and medicine for longer periods of time, your body will start to get used to it. It gets addicted. Okay, and suddenly if you will stop, your body will not allow you to body will crave that medicine, and it will show reactions. Okay, so depression, symptoms of depression because of some medicine or drug use, or suddenly abruptly you have stopped using these substances, and there are withdrawal symptoms because of that. Okay, so now we will be out of these what I can say, uh, I'll start screen share, and out of these, the whole list of under depression, there are certain disorders, three, four, which are very important, which you need to, I'll go in detail about, which your lesson is also covering in depth. Okay, so one is the under depressive disorders at different types, isn't it? So now we'll talk about the first one, that is major depressive disorder. Major depressive disorder, I will also mention that at least 2 weeks, the person should be experiencing these symptoms for minimum 2 weeks. Okay. So major depressive disorder includes being in a depressed mood most of the day, nearly every day. And what are those symptoms? Feeling sad, empty, hopeless, helpless, feeling, crying. There will be crying spells, appearing cheerful to others, loss of interest and pleasure in usual everyday activities. Even everyday activities, like, normal everyday activity of getting up from the bed, brushing teeth, taking bath. So the under major depressive disorder, they will not, it affects to such a severe level that even getting out of the bed okay, would be a major task for them. Okay, so they will be lying in the bed, okay, not taking part in everyday, like, taking bath, coming out, social interaction will become almost zero. Major depressive disorder is believed to be a combination of genetic, environmental, and psychological factors. All causal factors I'll cover once I've gone through all the disorders. Later on, I'll talk about causes altogether and treatment. Okay. So, is believed believed to be a combination of genetic, environmental, and psychological factors. Risk factors include persons who will be under greater risk for developing a major depressive disorder. Include what are those risk factors? One is if there is a family history of the condition, if there is a if there is a family history, parents or grandparents. So the closer the relative is, the more chance your chances will increase of that you will also develop this condition. And sudden major life changes can also lead to major depressive disorder. And certain medications can trigger that. Chronic health problem. So suddenly you've been diagnosed with some severe illness, some chronic illness. So coping up with that illness, getting that diagnosis can also lead to depression. And substance abuse is also one of the uh, factors. About 40% of the risk appears to be related to genetics. Genetics plays a very, very strong role when it comes to depression, not only depression, mood disorders. Major depressive disorder affects approximately 163 million people, according to statistics in 2017. That is 2% of the global population. Depression has become a very big deal. I mean, it has become, WHO has, come up with statements like, among the major illnesses, depression is also included in that category. Major depression is about twice as common in women as in men, although it is unclear why this is so, and whether we are not really sure what factors are contributing to it, but it has been found that major depression is more in women compared to men. What are the symptoms? What is the diagnostic criteria for major depression? Somebody is, why are you doing this? It distracts my attention. Somebody is scribbling on the slide. I don't know why. Anyways, so diagnostic criteria according to DSM-5, uh, the diagnostic criteria for major depressive disorder is to receive diagnosis of major depressive disorder. A person should experience depression with the symptoms of depression for at least 2-week period. And out of the list, which I'll be uh, uh, reading out loud to you people, out of that list, at least 5 symptoms have to be there from that list. Okay. So these symptoms must cause, because of these symptoms, it should cause significant distress in a person's life and also impair normal functioning of a person's life. Okay. And these symptoms should not be because of any substance abuse or medical condition. And the symptoms are significant weight loss. Even, the person is not dieting, okay? Because of depression, his or her appetite gets affected, and because of which there is significant weight loss or weight gain. Okay, so depression can go both in both directions. A person will lose appetite or will start to eat a lot. Okay, and so significant decrease or increase in appetite both are observed depending upon the individual. Difficulty falling asleep or sleeping too much, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty concentrating, indecisiveness, unable to make up their mind, cannot make decisions, thoughts of death. So, as I told you, mood disorders. One of the risk factors for suicide is mood disorders. Thoughts of death, not just fear of dying, suicidal ideations. So these that was the diagnostic criteria. And according to DSM-5, DSM-5 lists several subtypes of depression. Okay. And fastly, it is not really needed. It's not covered in your lesson, but as is there in the slide, I'm going to read out loud. Okay, so anxious distress, there are subtypes of depression. Uh, a person experiencing anxiety in the form of, restlessness, tense, lack of focus, fear, feeling that they are losing control. Another subtype is mixed feature. A person experiences some manic symptoms such as like very elevated mood, increased energy. So morning they will start off with feeling depressed. By the time it is evening, they will be energetic. Melancholic features, a person experiencing lack of interest or pleasure in their activities. Atypical features, a person may experience elevated moods for certain periods of time or around particular people, or may show weight gain, increased appetite, or excessive sleep. Congruent psychotic features, a person may experience delusions or hallucinations. Severe depression, delusions and hallucinations are also observed. Catatonia, a person may show catatonic symptoms that is like they will staying still, sitting still, they are like, immobilized, by for longer periods of time in same position, posture, they'll stay still. Seasonal pattern, which I just mentioned, it has been found that lack of light can trigger depression in people. Okay, and season, especially winter season, triggers depression. Peripartum onset is depressive symptoms appearing during pregnancy or in the weeks following birth. Now, the next, that was major depressive disorder. Now, the next is persistent depressive disorder. Next category of depressive disorder is persistent depressive disorder. Persistent depressive disorder, I was just mentioning it to you. The person, there is no symptom-free period. Okay, when you're talking about major depressive disorder, which I was talking to you just now, here the person will have depression, and after treatment, he will be free of symptoms. Okay, so episodic in nature, episodes. They will be like months, years also, or there could be just one episode in the person's whole life, and will never ever have depression. Okay, so that is major depressive disorder. Now here, persistent depressive disorder is a person will experience symptoms mild, but the symptoms will be same, but they are milder version of major depressive disorder, and they will experience mild to moderate version of depressive symptoms, and but they symptoms will continue for at least 2 years, and there will not be any symptom free period. Okay, and we also used to call this persistent depressive disorder by another name called dysthymia. Okay, so dysthymia was the name which was used for persistent depressive disorder in the earlier versions of ICD and DSM. So, a person experiencing mild to moderate depressed moods for most of the day, nearly every day, for at least 2 years, and displays at least two of the symptoms of major depressive disorder. So, depression, the symptoms under major depressive disorder, symptoms severity will be more, and the number of symptoms for diagnostic criteria would be more. Here, person depressive disorder, at least if there are two symptoms are there, and the and the and they will experience mild to moderate severity of the symptoms. Okay, so the same symptom: decreased or increased appetite, decreased or increased sleep, that is insomnia or hyposomnia, fatigue or low energy, reduced self-esteem, decreased concentration or problems with making decisions, feelings of helplessness, hopelessness, pessimistic attitude. Now, the next disorder is disruptive mood dysregulation, dysfunction disorder. So, disruptive mood dysregulation disorder uh, is a childhood condition of extreme irritability, anger, and frequent and intense temper outbursts. Okay, so DMDD, that is disruptive mood dysregulation disorder, symptoms go beyond a moody child. So there are certain people, children, like, some children, their temperament could be, some children, children differ by their temperaments. Everybody's temperament is different. So some children could be very moody in nature. That does not mean that they are having depression. Okay. Some children will, like, somebody scolds them, or they might sulk for few minutes or few hours like that. You cannot, that is not depression. Okay. So symptoms of, symptoms go beyond being a moody child. Children with DMDD experience severe impairment that requires clinical attention. DMDD symptoms typically begin before age of 10, but the diagnosis is not given to children under 6 years. Okay. You cannot call a person as having depression, that is DMDD, disruptive mood dysregulation disorder. Uh, Diagnosis cannot be given before the age of 6. And also, if adult, so from 10 years till adolescent age. So after 18 years, it could be persistent depressive disorder or major depression, because they come under the category of adults. Okay. So a child with DMDD experiences irritability or angry moods for most of the day, nearly every day. So depression is expressed differently in children and adolescents and differently in adults. And severe temper outburst, verbal or behavioral, at an average of 3 or more times per week, that are out of keeping with the situation. So it is not in context, it is not in line with situation. Okay. So the behavior is inappropriate to situation and the child's developmental level, his age, every developmental level. There are certain things which are considered to be normal for that developmental age, and not, the behavior could be abnormal. So, is not in keeping with the child's developmental level. Trouble functioning due to irritability in more than one place. So, because of these symptoms, the child will start to, the functioning in, there will, basically there will be trouble adjusting in school, academically, with friends, in home also. Now, the next disorder is premenstrual dysphoric disorder. Premenstrual dysphoric disorder is a health problem that is similar to premenstrual syndrome, but more serious. PMDD causes severe irritability, depression, or anxiety in the week or two before period starts. PMDD causes severe and disabling form of premenstrual syndrome, affecting 1.8 to 5.8% of menstruating women. So, what are the symptoms of PMDD? Lasting irritability or anger that may affect other people. Okay, so the family members or you know uh, uh, people around them, they will be uh, what you can say, like, they'll have to face this, the anger, the irritability which is experienced, which is uh, uh, what is the word I'm seeking? They display their anger onto them. Feelings of sadness or despair, or even thoughts of suicide. Okay. Feelings of tension or anxiety, panic attacks, mood swings, or having crying spells, crying very often, lack of interest in daily activities and relationships, trouble thinking or concentrating or focusing, tiredness or low energy, food cravings or binge eating, trouble sleeping, feeling out of control. Physical symptoms are also experienced, such as cramps, bloating, tenderness in the breast, headache, and joint or muscle pain. Okay, so with this, we have finished with your depression. Okay, so now we will be talking about bipolar disorder. So there are two majorly, when you talk about bipolar disorders, it features mood swings. Okay, so mood swings can include emotional high called manic or hypomanic. Now, when I'm saying mania, there are there are two types of uh, uh, mania, like, there is a manic episode and hypomanic episode. And a manic means, like, showing the full on what you can say, manic episode has just mentioned, like, the person will feel exaggerated levels of energy, high self-esteem, feelings of grandiose, I can do anything, achieve anything, and excessive spending, excessive need for speeding. They will have racing thoughts, they will be more talkative than usual, decreased need for sleep, as because they feel excessive levels of energy. Okay. And distractibility, So, and sometimes indulging in dangerous activities like, going on speed, I mean, uh, s- speed driving. So these are the symptoms, some of the symptoms of mania. And hypomania is a milder version of this. Because see, in mania, because of these symptoms, and they are at such a severity level, the person sometimes might need, because they will become very aggressive also, and aggressive and violent, might smash things, break things. Okay, so the symptoms of mania sometimes can lead to significant impairment in a person's functioning, and sometimes even might need hospitalization to prevent harm to himself or herself or others. Okay, so mania can cause significant levels of impairment in functioning and might need hospitalization. Okay, so in hypomania, same symptoms which I just described, but at a milder level. Okay, they are so same symptoms, but at a milder level, and the episode will not be so severe that it will cause some sort of a distress or impairment in functioning. And if they are experiencing hypomania, they it will not require hospitalization. Understood? So mania, severe form of, uh, I mean, that is a severe form of symptoms. Hypomania, milder version. Mania might require hospitalization and leads to significant impairment in functioning. Hypomania will not require hospitalization and will not cause much impairment in function. Okay, so why I'm explaining this to you? Because you have to understand then only you will understand the two types of bipolar disorders. Okay, so um, there are bipolar disorders. Uh, where am I? Okay, so bipolar disorders, there are two types of bipolar disorder, bipolar 1 disorder and bipolar 2 disorder. Okay, so are you able to see this slide?
Yes,
Yes.
ma'am.
Okay, so bipolar 1 disorder, and previously they used to call it as manic depressive disorder. Okay, so here in bipolar 1 disorder, it is characterized by a single episode of mania in their whole history, or there can be recurrent episodes of mania. For example, like there will be a one episode of mania after hospitalization, treatment, symptom-free period, and then maybe after 6 months, 3 months, 1 year, there could be another episode of mania. Okay, depress. So here, uh, depression. So manic episode, depressive episode will not be there in their history. Okay. So and bipolar 2 disorder, here it is characterized by single, at least one. There can be recurrent also, but at least on a minimum, there has to be at least one hypomanic episode and depressive episodes. So in that under bipolar 2 disorder, in their whole history, if you will see psychiatric history, the person can be having like 2, 3, 4 recurrent depressive episodes, and then also uh, there can be just one hypomanic episodes and 4, 5 depressive episodes, or there could be 2, 3 hypomanic episodes, or 2, 3, or just one depressive episode. So they, both are there. Manic in their history, there should be at least one hypomanic episode and depressive episode should be there. So the mood disturbance must be present for 1 week or longer in mania, and or 4 or longer days in hypomania. Okay, so at least symptoms should be there at least for 1 week if you are diagnosing as mania, and 4 days if hypomania. Concurrently, at least three of the following symptoms must be present in the context of euphoric mood. Euphoric means very happy mood, or at least four in the context of irritable mood. So, what are those symptoms? Inflated self-esteem or grandiosity. They'll feel like they are at the top of the world. They can do anything. They are like, achieve anything. They have, such high levels of self-esteem when they're experiencing this manic episode. Increased goal-directed activity or psychomotor agitation. They cannot sit still. They'll be continuously, they'll not be, there'll be so much of energy, they'll not be able to sit still. reduced need for sleep, racing thoughts or flight of ideas, distractibility, increased talkativeness, excessive involvement in risky behaviors. We've had a patient, manic patient, from the night, uh, uh, you know, bike speedily he would drive bike from Hyderabad to Warangal, from Warangal to Hyderabad, or they will go on, speed driving, car chases, bike chases, and excessive spending is also observed in people experiencing mania. So, what is the etiology cause? Although there have been important advances in research on the etiology, course, and treatment of bipolar disorder, there remains a need to understand the mechanism that so genetic influences have been found to contribute at least 73 to 93% of the risk of developing the disorder. Okay, so lifetime prevalence rate of bipolar spectrum disorder. See, all the books, most of them are written in US, so statistics are mostly from that country only. So, estimated at approximately 4.4% with bipolar 1, constituting at least 1%. There is comorbidity of bipolar with other psychiatric disorders has also been, and higher risk of suicide are also linked with all the mood disorders, be it depression or bipolar. Okay, so that was bipolar 1, bipolar 2. Then under bipolar disorders, there is another called cyclothymic disorder. Cyclothymic disorder is like I was just talking about persistent mood disorder this time, yeah, isn't it? No symptom free period, continuously experiencing milder levels of symptoms. This is similar to that. So here the person will experience heightened levels of mood swings. Okay, and milder episodes would be like the symptoms would be at a mild to moderate levels. Okay, so here cyclothymic disorder is a disorder that involves numerous periods of symptoms of depression and periods of symptoms of hypomania. It could be like 4 5 days. 1 week the person might continuously experience depression. Next week it could be mania, or it could be, I just as I mentioned, morning he will start or she will start off feeling depressed. By the time it's evening, high energy, hypomania. Okay, so in one day they can have uh, experience both the you can say like variances of mood, or it could be 2 3 days depression, 2 3 days, but there will not be any symptom free period. Symptoms are not symptoms are not severe enough. Important criteria is the symptoms which they are experiencing should not be severe enough to diagnose the person as having a major depressive episode or a hypomanic episode. Okay, and the milder versions of symptoms must last for more than 1 year in children and 2 years in adults. So, what is the diagnostic criteria according to DSM-5? Periods of elevated mood and depressive symptoms for at least half the time during the uh, last 2 years. That is at least 2 years for adults and 1 year for children and adolescents. That's teenagers. Periods of stable moods last, and even if there is a symptom-free period, it should not be more than 2 months. Symptoms create significant problems in their some one or two areas of function. It could be like academic area, job area, relationship wise. Symptoms do not meet criteria. These symptoms should not meet criteria for bipolar disorders, okay, or major depression or any other mental condition. And symptoms should not also be caused because of any substance use or any physical health medical condition. Okay. So with this, we have talked about with this, we have finished the mood disorders, depression and bipolar. Now, let's talk about the causes. What is the etiology of mood disorders? So, according to cognitive perspective, depression is triggered by negative thoughts, interpretation, negative self-evaluations and expectations. So, here the person, according to stress diagnosis model, Deich's set model, it proposes that depression is triggered by a cognitive vulnerability. That is, the person's experiencing depression, their thinking is very negative in nature, very negative and maladaptive thinking, pessimistic type of thing that, they are helpless and hopeless, they are not good enough, and the people around cannot be trusted, and the world is a very dark place, and future is hopeless and helpless. And this could be because of some stressful life, which could be triggered because of stressful life events. And according to socio-cultural perspective, depression is more prevalent in women than in men. And some people have hypothesized that this is because of, because of the culture where women have, are placed at a very inferior positions compared to uh, men. So in which they experience domestic, so women experience more domestic violence, poverty, financial difficulties, inequality, even like, inequality at home, inequality in their professions. So in every area, inequality is observed. So these things can greatly contribute to depression in women. That is why depression is more, the statistics show that women, is more prevalent in women than men, according to sociocultural perspective. Psychodynamic perspective, according to this perspective, depression is caused because of unresolved unconscious conflict or repressed anger towards other. Unable to express anger, they are just, they are repressing it, pressing it down, and it's expressed in the form of depression. So the person might maybe so plagued with inner conflict, anxiety, and guilt because they, guilt is experienced because anger towards others, or they are not achieving what they're supposed to achieve. They are disappointing their parents. It could be like anything. Okay, so I'm not good enough. I'm a disappointment to my parents. So, and deal that they are unable to perceive, so they cannot perceive, they're not able to understand reality uh, in a very clear manner. Okay, and they face difficulty in meeting ordinary demands of the environment in which they live. Okay, so which can lead to symptoms of depression. And according to humanistic perspective, according to Abraham Maslow, he is one of the foremost humanists. Uh, mm, uh, okay, and he emphasizes, Abraham Maslow emphasizes on hierarchy of needs and motivations. So existential psychology, Rollo May is existential psychologist. Okay, he says that, we have a choice. Humans have choice. You can choose to be happy or you can choose to be unhappy. So, and rather than like trying about what type of life you have been given, do something about it. That is what they believe. So, so that is what, people who are like, crying about past, not achieving their potential, blaming others, don't take self-respect. So they give a lot of emphasis on responsibility. It is your responsibility to achieve whatever, like, achieve your potential. You cannot continuously blame parents. Okay, so that is what they believe. So person-centered, client-centered therapy of Carl Rogers, this also is centered on clients' capacity for self-direction and understanding their own development. And when they are not able to achieve that self-actualization, then there are certain, you can say, restrictions towards achieving their self potential, then persons experience depression according to humanistic perspective. According to behavioral perspective, depression emphasizes the role of maladaptive act. So they say maladaptive action play in the onset and maintenance of depression. So, according to Pavlov and Skinner, they are often, I mean, not according to Pavlov and Skinner are often credited with the establishment of behavioral psychology with the research in classical conditioning and operant conditioning. So, what are the biological causes uh, of mood disorders? There is as I mentioned also, there is a strong genetic and biological basis for mood disorders. Relatives, the closer the relative, relative having mood disorder, the greater the risk that you would also develop depression or any of the mood disorders, be it bipolar or depression. So relatives of those with major depressive disorder have double the risk of developing major depressive disorder, whereas relatives of patients with bipolar disorder have 9 times the risk of developing mood disorder. So that is the genetic component. So depression, twice the risk. Bipolar, 9 times the risk. Biological, people with mood disorders have found to have imbalances in certain neurotransmitter levels, especially particularly serotonin and norepinephrine. If there is an imbalance in these two neurotransmitters, norepinephrine and serotonin, uh, they have been implicated, they have been found to be responsible for triggering depression and mood disorders. Research has also noted that depressed individuals have abnormal levels of cortisol. Cortisol is a stress hormone released when one person experiences high levels of stress. Okay, when person uh, uh, because of high levels of stress, it triggers flight and flight response. When flight and flight response gets triggered in the body, body releases cortisol. And they found that abnormal levels, high levels of cortisol, is been found in people depressed individuals. So basically, in another way, what I'm trying to tell you is, if a person is under a lot of stress, continuously experiences high levels of stress, uh, tendency is the person might develop depression. Many people with depression also show elevated cortisol levels, especially those reporting a history of early life trauma, such as loss of a parent or abuse during childhood. That is also uh, can see high levels of stress will trigger high levels of cortisol, and in some way these cortisol levels are also playing with the body's chemistry and triggering depression. So high levels of cortisol are a risk factor for future depression. So if you will go, not only that, high levels of cortisol, uh, if there are blood tests, can also trigger heart problems, because stress has been linked with heart issues. Okay, cardiac problems. Now treatments. So two treatments: medicine, medical treatment, or psychotherapy. Okay. So medical treatment, serotonin. We just mentioned, like uh, serotonin is responsible for depression, mood disorders. So the medicines which are given for antidepressants, which are given to persons with depression or basically mood disorders, they target towards correcting these imbalances. Okay, so if there is a low level of serotonin, then the medicines are given to see to it that I cannot explain SSRIs, SNRIs. That is like a very clinical terms which you really don't need. So just understand that because of imbalance in serotonin and norepinephrine, uh, person will experience mood disorder. So medicines which are psychiatric medicines, antidepressants, they function by correcting these imbalance. That much is enough for you. It's like when you're doing clinical, then we have a whole paper on psychopharmacology. So that this is not needed. Other biological treatments for depression is ECT. ECT is electroconvulsive therapy, transcranial magnetic stimulation, and deep brain stimulation. These are different types of biological treatments which are also given apart from medication. So lithium is what the drugs which are usually given is lithium is very famous. You people might have heard about the name. Lithium is the first line treatment of choice. That is a medicine which is given for mania or hypomania. Okay, so with this we have finished your mood disorders. I still have 10 minutes. So I thought, see, because we are talking about depression, we are talking about mood disorders, and high risk of suicide is associated with mood disorders. So when you are talking about mood disorders, next step is to talk about suicide. And there is a lesson uh, on suicide and non-suicidal self-injury. So I thought I will start that lesson. Okay, just a second now. Do you know which lesson is suicide? Anybody? Gone to sleep?
No, ma'am.
Pardon, madam.
Out which
Please
lesson
repeat.
is suicide and non-suicidal self-injury?
Pardon, madam. Will you please repeat the question?
You have your soft copies with you?
No, madam, not yet.
Okay. So
It is
there is
Unit 12, ma'am.
yes. So there is a lesson on suicidal behaviors and non-suicidal self-injury. Okay. So I am going to cover that lesson uh, now because mood disorders very closely linked with suicidal behaviors. Okay. So we have some 5-7 minutes. I'll start off with that list. Okay. So let's talk about suicide. So suicide is one of the leading cause of death in the world, and it has been estimated that 1 million people die by suicide every year, and many more make unsuccessful attempts. Such attempts are called parasuicides. Okay, so it is one of the leading causes of death around the world, and it is and what we believe is when I said at least 1 million people 1 million people die by suicide every year. Researchers, we believe that these now the numbers are much more than this. Our estimates are low actually. Why? Because many a times the accidents, there are many accidents. Sometimes they could be intentional deaths also. And second is suicide is frowned upon in a society. Uh, so relatives and friends, what they will do? They will refuse, often they will refuse to acknowledge that their loved ones have taken their own lives, and that does not get reported. Okay. So, the rates, the numbers could be much more high than 1 million. And one important thing you have to understand, suicide is not classified as a mental disorder in DSM-5. Clear on this? Suicide is not a mental disorder.
Okay.
Okay, it is not classified as a mental disorder in DSM-5, although suicide is frequently linked with mental disorders. It's frequently linked to depression, and around half of all suicides result from other some mental disorders or you know uh, because of mental disorders. Understand? So, what is a suicide? According to Schneidman, he defines suicide as an intentional death, a self-inflicted death in which one makes an intentional, direct, and conscious effort to end one's life. Okay, and all this definition you can find on Google. Okay, so that is suicide. And what are the statistics? Suicide rates of men and women differ. Women have a higher attempt rate. Men have a higher completion rate. Okay, women attempt more number of suicide, but men have higher completion rate. So sometimes see attempting suicide and dying by suicide, two different things. So sometimes help is provided on time, the person is saved on time, he or she might get help. Okay, why that woman attempt? There are higher rates, three times more than men, women, or three times more men women commit. I mean attempt suicide than men, but men have four times higher completion rate than women. Why? Because different methods are used for attempting suicide. Men tend to use more violent methods such as shooting, stabbing, hanging themselves than women. Women have been found to use, poison, drug overdose. So violent methods are used by men, because of which higher rates of completion. Suicide is also related to social environment and marital status also. One study found that half of the subjects who had committed suicide were found to have no close friends. So, suicide rates are higher in people who have no social support, is socially isolated. Okay, and studies have also found that divorced people have higher rates of suicide than married or cohabiting individuals. So, marriage actually protects you from suicide. So, what triggers a suicide? What are the causes? What triggers a suicide? I think in a 1 or 2 minutes, so maybe I'll one or two things I'll say and then I'll stop because it is 8:57 already. So, what triggers a suicide? Suicidal acts may be committed.
Loneliness.
Huh?
Loneliness.
Yes. So, suicidal acts may be connected to recent events or what the current condition of in a person's life. Okay. So, but that is not the only factor. Such factor may not be the basic motivation, but they precipitate it. They can trigger if their conditions are very adverse. Some recent event has happened. Okay, so common triggers could be stressful event, mood and thought changes, negative thinking is observed. Alcohol and drug use can sometimes trigger suicide. Mental disorders are also responsible for suicide and modeling. I'll explain about modeling tomorrow. So these are the causes of suicide, and one by one I will take. So stressful event situations could be like, so it has researchers have found that, people who have attempted suicide, when they counted the uh, number of stressful events in their life, uh, with people who had never attempted suicide in their life. So all of us have nobody is free from ups and downs of life. All of us have difficulties. Okay, but in a year, when we measure stress, uh, so there is a stress scale also. In a year, if high levels of high the more the events, number of events, if a person experiences more number of events in a year, his levels of stress would be high. Okay, so they found that people who attempted suicide, they have had more stressful events compared to people who had never attempted suicide. And they have also found that veterans, army, combat stress is also linked with suicide. And immediate long term and immediate stress or long term stress can also be a risk for suicide. Immediate stress would include death of a loved one, loss of a loved one, loss of a job. If there is a natural disaster, then that is an immediate type of stress. So this can trigger suicide. And what would be long-term stressor? Long-term stresses could be like, as somebody said, loneliness, social isolation. The individuals who will not who are without social support are very vulnerable to suicide. I think they will stop now. Maybe.